My role here at Peter Mac is really to understand essentially the wiring diagram of ovarian cancer. Well, we focus on a number of different things. They're all very clinically driven questions, so things that I think people would find easy to relate to. Why does a cancer respond to treatment and then become resistant? What are the genes that a woman might be born with, or her daughters or her relatives, that increase the risk of developing ovarian cancer, and how can we use that information to guide prevention of disease and treatment? So one of the things that we played a really important role in is understanding the role of BRCA1 and BRCA2 in the risk of developing ovarian cancer. And what we found was that those mutations were much more common in women with the most common form of ovarian cancer. It's called high-grade serous cancers. And that led to a complete revision of the way that genetic testing is done in this country for ovarian cancer and in other countries. And so we need to know about these genes because other members of the family could carry them. And what we want to try and do is prevent the development of cancers before they occur in carriers. Traceback is a response to us understanding that BRCA1 and BRCA2, BRCA1 and BRCA2 are more common than people appreciated, and now going forward, any woman who has common forms of ovarian cancer should be offered genetic testing. And so we start to pick up these mutations and can adopt risk-reducing strategies for other family members. And it also has important implications for the woman in terms of her treatment. But there's a whole lot of women who unfortunately missed out on that new knowledge, and Traceback is an effort to go out and to identify them and to offer genetic testing to either them or particularly to family members if that patient has died of their cancer. We're recruiting people to Traceback in a number of different ways, but one of the really important opportunities is what are known as cohort studies. So these are patients who have been recruited for research purposes, with their permission obviously, into these large studies of collections of women with ovarian cancer. We're hoping with Traceback that we will prevent, in the end, several thousand breast and ovarian cancers, because not only do BRCA1 and BRCA2 increase the risk of developing ovarian cancer, they also increase the risk particularly of breast cancer, but some other malignancies. And so that by identifying people who carry these mutations and offering them the opportunity to receive that information and to adopt risk-reducing strategies, we hope to prevent them actually developing the cancers that their mother or their aunt developed in the first place.